What is the relationship between prayer and longevity? This is an answer that I've asked myself for almost 25 years. In fact, what I'm going to show you in this video is how having intentionality around your life, and prayer is a massive expression of intentionality, you can change your physiology and actually encourage greater levels of longevity. I'm going to talk to you about one of my early professors in my training in Hawaii named Regan Archibald. And I'm going to show you some of the studies that might actually get you praying again. And I'll also talk to you about one of the techniques that we do at East West Health called Mindset Morning. And probably a lot of you have heard me talk about this, but now I'm going to layer in some of the evidence and show you exactly how it can lead to your longevity. So my goal with this video is for you to have 3 things happen where you actually start practicing a ritual of prayer or some type of affirmation or intention for your day. The second thing is for you to realize how your biological systems can actually change based on your intentionality. And then the third thing is for you to start sharing your insights with other people as you go through it. So let's jump into the science. So who's Regan Archibald? Well, Regan Archibald, she was studying the aspects of prayer from a non-local perspective. So what that means is she wanted to see if somebody in mainland, let's just say Iowa, if they prayed for a patient in the hospital, some of my internship at the Northern Hawaii Community Hospital, she wanted to see if they would be influenced by prayer. And I thought it was really fascinating as we went through this process with her. As she was doing her science, she would come and teach us in class what she's learning. And she used a book she had us read called Molecules of Emotion by Candace Pert. And Candace Pert, what she realized is this concept called psychoneuroimmunology. Man, that's a mouthful, right? Say that 3 times. Psychoneuroimmunology. And she found that the immune system and the brain and the emotions are all intertwined. So there's no separation between mind and body. But Regan Archibald, like many of you, she was open-minded. She just said, I want to see what the physiological aspects are of prayer. And how many of you have had great experiences with prayer throughout your life? How many of you have had not so great experiences where you're forced to pray at awkward times? Whatever works for you is great. But here's what Regan Archibald learned. As she was going through her research, she found that there's actually key components in your physiology that are influenced when you pray. And she looked at neutrophils and lymphocytes. So if you think of your blood labs, when we run your blood labs, we'll look at the relative percentage of neutrophils, which neutrophils are going to be activated if you have an infection, like a bladder infection or maybe you've got a respiratory infection. Neutrophils help mobilize the forces around the infection for bacteria. She looked at lymphocytes. When lymphocytes are elevated in your blood, there may be some kind of viral infection or even a bacterial infection sometimes can trigger lymphocytes. And she wanted to see if these are the most robust of the white blood cells. You're going to have the most quantity of neutrophils, and then the second most will be lymphocytes. And what Archibald's study with Mark Ritter found is that music-assisted imagery significantly increased neutrophils, or that part of the white blood cell, and it altered the lymphocyte activity. So with people who had high levels of lymphocytes relative to neutrophils, and roughly you want twice as many neutrophils as you do lymphocytes in your blood, she found that just by doing this visualization with music, so putting people in this deep expressive state, actually remodulated the immune system. She also found that the imagery that she would express and use with these participants, it changed the T cell activation. And so the T cell activity was really important because our T cells are what identify cancerous cells in the body. So imagery is actually really darn important. She also found that with prayer, the brain function changed. And so she used a technology called functional MRIs. And the functional MRI is where you can see different expressions in parts of the brain when people are praying. And what she found is that in her study, recipients of distant intentionality, so when there's prayer going on through healing thoughts, she showed statistically significant changes in the brains of the recipients who are actually the ones that are undergoing the healing process. And so she found that this focused intention can non-locally impact people in your life. So how many of you have ever prayed for somebody and wondered, is it really doing anything? Well, she's got evidence that by doing functional MRIs on those people who are recipients, that you can actually see changes in brain activity compared to the control people who weren't receiving prayer, and seeing if anything changed in their MRI, nothing changed. Whereas the people who someone was praying for them had statistically significant changes. Kind of weird saying statistically significant, but I'm getting there. What does it do for pain? What Dr. Achterberg realized is that people who had pain, she found that by using prayer with guided imagery, they were able to reduce pain during medical procedures. So at Northern Hawaii Community Hospital, is a hospital founded by Earl Bakken, we're able to do a lot of work with that hospital, and the doctors there were a lot of my instructors. But every patient received healing touch. So they actually had healers that would come in and work on these patients. A lot of these patients received acupuncture, chiropractic care, naturopathic care. So it was a holistic hospital, and it's beautiful. But Jean Achterberg, what she found is that just by doing this imagery, mothers who were delivering babies, they had less sensations of pain. People who had had massive burns in the hospital, and when they were getting treated, their pain perception went down just through some of these visualization techniques. And then they also found that it modulated the body's stress response just by using imagery through the release of endorphins. So you can actually stimulate your own opiate receptors just by doing prayer and having guided imagery. She also found post-surgery that patients using this imagery actually had reduced blood loss during surgery and faster recovery times. So for those of you who are like, I don't know if prayer works and is God listening? Well, I don't know if anybody's listening, but I do believe that there is a massive energy that changes in this beautiful world that we live in just by you having the right intentionality, by you having the intentionality of helping change somebody's life. Now, I brought this work into my own clinical skills. Every morning, I do what's called the mindset morning. And I have just 2 minutes. The first minute, I just clear my own energy. I just feel my body. I feel this enormous love, and I feel all the energy that's rushing through my veins. Then I focus for the next minute on who I want to help and how it's impacting them. And I visualize you injecting your peptides or getting stem cells, and I visualize the outcomes that you have. Now, we have thousands of amazing patients and clients of ours, and it's a non-local expression. You can actually influence thousands of people just with your thoughts. Joe Dispenza, if you follow some of his work, Joe Dispenza has probably got the most compelling data on this to date as well, on how your thoughts can help influence other people. What did she find on disease progression? Dr. Achterberg, she observed that cancer patients who practiced this intentional prayer and intentional imagery actually had a better outcome. And what she had them do is visualize that cancerous tumor, those cancerous cells, actually shrinking. She also found that their immune system was more engaged and healthier, and they had better outcomes. The other thing she found is that when she worked with patients with rheumatoid arthritis, and one of the patients, her name was Martha, she was one of the first patients that I worked with where I didn't have a supervisor there kind of breathing down my neck. It was so cool to see her transformation. Yes, we had her on specific treatments, but she was also engaged in this research with Dr. Achterberg. And her hands went where she couldn't hold a tennis club, and she loved playing tennis. She was a woman in her late 50s. I think she was 58. And at the time I was working with her, I worked with her for the course of 2 years, and within 3 months, she was playing tennis again. She was on a drug called methotrexate, which is a chemotherapeutic drug that seems to suppress some of the RA symptoms. And she was able to decrease the volume of that drug she was taking by like 50%. It eventually got off of it. And what Dr. Achterberg realized is that, yes, there was a massive immune regulation and stress reduction. The other thing Dr. Achterberg looked at is the autonomic nervous system in patients who used the prayer. And she found that this imagery was able to balance out cortisol. She found that when people visualized and prayed for stress resilience, the little things didn't set them off. So people who had PTSD. She also lowered the cortisol levels in patients who had high cortisol just by having that intentionality and by having prayer. She looked at blood chemistry markers. And so there's correlations by looking at reduced inflammatory markers. Some of those chronic inflammatory markers like tumor necrosis factor alpha, IL-6, those all dropped. And she found particularly in cancer patients, their hormone levels actually became healthier. Because I don't know, even in the chemotherapy patients, their immune system got healthier and their hormones got healthier. So all in all, what Dr. Achterberg realized is it doesn't take a lot of time to start changing your biology, because your biology is moldable. You can influence it with thoughts. Bruce Lipton wrote a great book called Biology of Belief, where he proved this to be the case. And that book was written over 25 years ago. And the science is actually just more robust these days. So here's the challenge to you. Just take 2 minutes, take a timer right now, set a timer, and just start getting in tune with your body. Just start doing breathing and just visualize this beautiful white light glowing throughout your entire body. Breathe in this nice harmonic colors, whatever color comes to mind, maybe gold, maybe yellow, some kind of vibrant color. And then just breathe out and just let this energy flow through your body. When the minute goes up, now I want you to visualize something you want to heal in your body. Maybe you want to heal your lungs because you've been exposed to a viral infection. Maybe you want to heal your liver so that you can metabolize things better. Maybe you're looking to fix your metabolic system or your joints like your knees. Maybe you've got an autoimmune disease. But now just visualize that getting better. For those of you who are clients of mine and you're doing your peptides, you're taking your supplements, part of the mindset that you need is having intentionality. So when you pull the peptide up, like this morning, I did my melanotan, and I also did thymosin beta-4, and I did BPC 157. So as I'm injecting that, I'm imagining the nitric oxide. I'm imagining my skin having better tone and better color. I'm imagining my heat tolerance being better because of melanotan. It actually helps with that. And then I'm also visualizing my stem cells through the thymosin beta-4 activated in my body. And just by doing that process, you're thinking about the things that you want your biology to do, and it helps you have a better outcome with your peptides. And you probably have noticed in the clinic, when we have you do your stem cell injections, Dr. Steinley will have you hold your stem cells, and as you're thawing out that little vial, you're putting your intentionality into that beautiful life force that's going into your body, and you're asking it, you're praying to have a great outcome from this treatment. Now, these things might sound very esoteric. You may be closed off to them, but I can tell you from the work that Dr. Gene Achterberg has done, Dr. Joe Dispenza, Dr. Bruce Lipton, so many great researchers and clinicians have proven this to be true over time. And there's good reason why humans have been praying, since the beginning. I mean, some of the first written words were about prayer. And so if you love this video and you're like, hey, will this extend longevity? Well, this is one of the best ways you can do it, is just visualizing every day. What do you want your life to look like in the next decade from now? And just keep framing it into the next 10 years, and you'll notice that your body actually gets younger from a biological perspective. And if you like that, you want to know, well, what's the best foods to eat? Well, I also have a video for you that you can go. I've provided in a link below, and it's the best foods for longevity. So I'm Regan Archibald. Love you, appreciate you. Here's a prayer going out to you that everything in your life is healed and you become the best version of yourself. And I'll see you in the next video.